The time was 1997, and in Kampung Sungai Nipah, Malaysia, an infection began to spread in the local pig population. It was initially thought to be a tropical swine fever, but soon it was discovered that the virus was zoonotic, meaning it may be passed from animals to people, and it had a mortality rate of 40 to 75%.
The first major outbreak of this infectious disease displayed symptoms of the Japanese encephalitis, aka JEV, a zoonotic virus that spreads by mosquitoes, which was first found in Japan. Encephalitis means inflammation of the brain, and it can be fatal if not detected. Many of those who fell sick were pig farmers, their family members, and nearby residents. Those at risk of infection were given multiple doses of the JEV vaccine, but it proved to be futile.
It's now 1999, and our unsung hero, Dr. Chua, came into the picture. A pig farmer with severe encephalitis was admitted to the University Malaya Medical Center, where he was put under the care of Dr. Chua. Although this patient had been tested positive for JEV, considering the extraordinary infectious power the virus had, Dr. Chua didn't want to dismiss the possibility of this being something different.
At the time, authorities were convinced that the virus was indeed JEV, so Dr. Chua had to make up the excuse that this could be a new variant of JEV to convince his head of department to let him isolate the virus. He ran a test on the isolated virus, and the results showed that it was something very different from the JEV. When he rushed to show his head the findings, the head dismissed it as contamination, but Dr. Chua became even more determined to discover the truth behind this infection. He continued to gather evidence by performing several other tests. Eventually, he was able to prove to the head that this was no known virus to date.
Dr. Chua's findings were presented at a meeting with representatives from the Ministry of Health and Veterinary Research Institute the following day. After this, the Ministry of Health granted him a visa that allowed him to travel to the USA, where he was able to formally identify this new pathogen as the Nipah virus.
As a result of Dr. Chua's efforts, the Nipah virus's route to pigs was discovered, and new control measures were put in place. The outbreak of the Nipah virus was declared to be over after 265 reported cases, 105 of which resulted in death. It's not hard to imagine how much worse this could have been if not for the identification of the Nipah virus.
Currently, there's still no specific treatment. However, the first ever vaccine for the Nipah virus has been developed at the University of Oxford and is currently undergoing early stages of in-human clinical trials. So let us hope that the trials for the vaccine are successful, and remember the hero that first discovered the Nipah virus despite the setbacks, Dr. Chua Chua.